we are learning about the biomechanics of knee complex. The knee is involved in mobilizing the body and supporting the body weight along with the hip joint and the ankle joint. The knee complex is formed by two joints, the tibiofemoral and the patellofemoral joint. Here is the femur, the patella forming patellofemoral joint, and the femur and tibia forming tibiofemoral joint. About the fibula we are talking next. The superior tibiofibular joint is not the part of knee complex because it is not inside the knee joint capsule, so it has less role to play in structure, and it is not involved in weight bearing, so it has no significant role in the function. But the distal tibiofibular joint is functionally related to the ankle joint. Next, we are looking at the tibiofemoral joint made by the tibia and the femur. It is a double condylite joint with 3 degrees of freedom. Let's look at the motion. Sagittal plane around coronal axis we have flexion, extension, flexion and extension. In the transverse plane around longitudinal axis, we have medial internal rotation and lateral external rotation. Observe the orientation of tibia in this picture. In the frontal plane around anterior posterior axis, we have abduction and adduction. Here's a picture of adduction and abduction of knee joint. And here's the summary of the motion we saw. Now we will look at the bones starting with femur. The distal end of the femur forms the proximal articulation of the tibiofemoral joint. Observe that the medial condyle is larger, has greater radius of curvature and projects farther than the lateral condyle of the femur. We'll be looking into the reason behind this. The femur in green, the tibia in brown, the femur is angled and this is the right leg. The only way we can fixate the femur on the tibia is by making the medial condyle larger than the lateral one. The medial condyle is larger to compensate for femoral alignment. The epicondyles are enlargements superior to femoral condyles. The anterosuperior aspect of the condyles form a groove known as intercondylar groove, and it is here the patella articulates. The intercondylar fossa separates condyles at inferior and posterior aspect. The cruciate ligaments transverse here. Through this picture, we observe that the medial femoral condyle is larger than the lateral femoral condyle. These are articulations for tibia. The lateral patellar surface is larger than the medial patellar surface. Now we'll learn about the tibia. The proximal tibia forms the distal portion of the tibiofemoral joint. The articulations are smaller compared to the femur. The medial tibial condyle is larger than the lateral tibial condyle, similar to the femur. The medial knee bears more pressure while standing, so the greater surface area reduces amount of stress. The intercondylar tubercles are two bony spines separating the condyles. During the knee extension, the tubercles lodge in the intercondylar fossa of femur. The tibial plateau is bigger than the shaft and overhangs it. Moreover, the plateau is inclined posteriorly to about 7 to 10 degrees. This is significant for flexion.